So here we are with the second installment of the free demos. This time it's the dynamic massage cupping using silicone cups. I was going to do dynamic cupping also using fire cups next month, but because of COVID-19 and everybody using hand sanitizers that has alcohol, if you have hand sanitizers in your hand and then fire, you can actually put your hands on fire. I have not been using fire cupping, so it was easier for me to just scrap it, and we're going to try to do something totally different for September. October, I do believe I have, what do I have? Sports Thai massage on the table. My version of the sports massage using Thai massage. And in November, chair massage using the massage chairs that we have here, the traveling massage chairs. And also I'm going to try to see if I can put together something that people doesn't have massage chairs. They can use pillows with a table and chair. I have to figure out how to videotape it because it's very difficult to do live. So let's get started. Dynamic massage cupping. We'll do the Q&A afterwards. And let's see here. There we go. What is cupping therapy? So cupping therapy is an ancient form of alternative medicine, which a therapist puts special cups on your skin for a few minutes to create suction. People get it for many purposes, including to help with pain, inflammation, blood flow, relaxation, and well-being, and as a type of deep tissue massage. Cupping therapy might be trendy right now, but it's not new. It dates back to ancient Egyptian, Chinese, and Middle Eastern cultures. One of the oldest medical textbooks in the world, the Ebers Papyrus, describes how the ancient Egyptians used cupping therapy in 1550 BC. So another thing with cups, it's not just silicone cups, it's not just glass cups. Olden days, they use horns, yung sungay ng mga animals, and also sometimes bamboo. The cups, they made cups out of bamboo, so they just invert it, and I don't know how they create the suction though, but there's so many different ways to do that. So yeah, the cups may be made of glass, bamboo, earthenware, like, kind of like pots and silicone. So glass, bamboo, earthenwares, and silicone. So the benefits of massage cupping: it reduces pain, increases flexibility on some, depending on how it's used, increased circulation of blood flow. Every massage type of modality always increase circulation and blood flow. It also reduces muscle tension. There's more benefits to massage cupping, but it all depends on how it is used. So here are some of the contraindications. Fever. You do not want to do any type of massage or especially massage cupping when somebody has a fever. The reason why somebody has a fever is most likely they have something that the body is trying to kill, like a virus. So when somebody has a fever, most likely they are very highly contagious and you don't want to be around them. Anybody who's diabetic, it may not be good to use massage cupping on someone who's diabetic because there are times in which if you use it on the hands and feet, they may not be able to feel it. Severe edema. You don't want to do any kind of cupping because cups suctions pulls fluid towards the surface, and if they already are inflamed and swollen, you don't want to put more fluid in that area. You don't want to also do massage cupping on someone on blood thinners. The reason for it, if there is internal injury, they may bleed to death. Hemophiliacs, they do not have clotting factors in their blood, and so if there is any kind of internal injury, they can also bleed to death. And anything that is generally contraindicated for massage, you don't want to use massage cupping. So we're going to go to a YouTube video. So the silicone cups, the way it's set up is you can actually pick it up. You can pull it, move it around, and that's basically why I prefer the silicone cups. We will now go to the video that I created with my friend and also a therapist in my office, Gwen. Thank you for joining us at the demo here. This is Lynn Yoncha, LMT, and I'll be working with Gwen here. And with Gwen's help, I'll show you some of the techniques I've been using when I do massage cupping, dynamic style, to any of my clients. So today I'm going to be showing you a technique that I do on the back. It's not the same thing as far as I don't have a particular routine. I just do the massage, try to see what I need to work on. So right now what you can see is I'm actually doing a little bit of trager work and stretching along the spine. And now I'm going to do trager to see which side of her spine requires more help or more release. Here I am testing out the right side of the spine, mostly on the mid-back, and it seems to be a little bit restricted. Now on the other side I have to do the same thing to make sure I try to balance Gwen out. Looking for the low back, moving up to the mid-back, and it's not as tight as the right side, and then basically making my decision as far as how the session is going to turn out. So usually when I start a massage, I basically do an assessment. Most of the time it is trigger technique that I use. In order to be a clinical massage therapist, you have to know how to assess your clients. Without the assessment, you have no idea how to proceed with the session. So here I am undraping my client and getting ready to do a massage. First using Effleurage, to assess the skin, to make sure that her low back is also moving, the skin's moving, not just the joints, and also how restrictive is that skin on that mid-back. I'm not using a lot of lotion, and I do prefer to use lotion when I'm doing a massage because I prefer a little bit of myofascial release when I am doing Effleurage on my clients. And when I am ready to do massage cupping on my clients, I actually use coconut oil. It's thinner and easily spreads, so I really prefer coconut oil. So now you can see that I'm actually using my forearm, doing a lot of deep stroking massage, mostly effleurage, but here I'm slowing down and doing a little bit of trigger just to loosen up that right mid back. If you can notice, I'm actually doing a lot of different speeds of my strokes. There's a quick speed, slow speed, and so on and so forth. The quick speed, the faster I go, it's usually not very deep, but if I go very deep on the client using my elbow, my forearm, or my hands, I slow down. As you can see, I incorporate a lot of trigger work in my session. What you do to one side of the body, you have to do to the other side to make your client feel balanced. At this time, my client is ready for massage cupping, so now I am applying coconut oil. I prefer coconut oil because it is thinner than most of the oils I've used in the past, and I like thinner oil because it's not sticky afterwards. I'm making sure I am putting a lot of coconut oil on her back because everywhere I'm putting that oil is where the cup is going to go. So my client is now ready to get massage cupped. So I'm rubbing the cup on my hand to warm it up so that when I place it on her body, it is not starting out cold. So now what I'm doing is I'm just going up and down on a linear version on the ESGs on both sides just to get some blood flow going in that area. focus with the massage cup is to increase mobility on that right side, the mid-back, and everywhere along the spine. The reason why it's called dynamic cupping is because you are using the cups as a massage tool. You are moving it all over in different areas, linear, cross fiber, and everything. It's also used for adhesion removal. I have actually used the cups to help scar tissues. Actual scar, to remove or to minimize the scar, keloids. And another thing that I use the cups for is if there is a tight spot, I tend to leave it on there for about no more than 3 minutes, like what I'm doing right now with her mid-back, trying to get blood into that area so that hopefully the muscle will start relaxing and I can work with it better. Sometimes when I do massage cupping, it almost feels like I'm using an eraser and I'm trying to erase all the pain, trying to erase all the stiffness. It's good to reapply more coconut oil on the client's skin. Because of the fact that the cups uses negative pressure, it tends to pull on the skin a lot. And then also, the way I use the cups vigorously to break apart any kind of adhesion, you definitely need a lot of oil to make sure it doesn't hurt the skin of the client. Another thing, the reason why you use a lot of oil, it helps keep the seal of the cups. Of all the massage cupping tools that I've used, the silicone cups, especially these kind of cups, are my favorite. As you can see, I can actually lift it a little bit and also do a lot of vigorous moving, trying to break those scar tissues underneath the skin. So once in a while during your session, you need to check to see how your work is going. You don't want to over massage cup the area. So what I did is I pulled out the cup to make sure that area was a little looser, and it was. And I'm going to do a little bit more just to get it going again and loosen them up as much as possible within this particular time frame. So after I use the cups, I go back and finish off with Effleurage. Now here's a trick that I use to take off all the excess oil on the client's back. I use the sheets to wipe off any excess oil, at the same time do a massage, and at the same time try to get as much of the oil off my hands. I just wanted to let everybody know we are trying to be as socially distanced as possible, and the fact that I'm facing the camera and she's also facing the camera, and hopefully.
Can I take
Which one?
Can I take the mask off?
Yeah, you can take the mask off.
I'll take it down.
So, Gwen, this is Gwen, one of our massage therapists, and she was the person on the table, the demo, and I just wanted to make sure that I can ask her some questions and she can answer and give me feedback on the massages she received. It was only about 15-20 minutes long, and it was all done on the back. And the whole purpose of this is just to demonstrate how I do my massage cupping, and I use silicone cups most of the time. Because of COVID, and the fact that we use hand sanitizer, I do not do fire cupping, in which next month's fire cupping will be canceled, and hopefully, maybe if I have time, replaced by something else. And hopefully Gwen will assist me. Okay, so Gwen, tell me your feedback on that massage. You said something a little bit before we started shooting at the camera, and what was it that you noticed the difference?
The first thing I noticed and I liked is, one, you started off with deep tissue prior to applying the cup, which at that time, I couldn't tell the difference between your hand and the cup. That was awesome.
Okay. That's the whole idea with massage, is I make sure that I do things and nobody can figure out what I'm doing.
Yeah.
So, oh, and because the fan is on, you might want to raise up your voice slightly because the camera is over here.
Okay.
So, any other feedback concerning about how you couldn't even feel that it was my hand versus the cup?
The gliding of your hand, the gliding of the cup, and the suction when it would pop up.
Mm-hmm.
That was a really good feeling, because then there's a warm sensation that goes through, under your skin. And even when there was a sore spot.
Oh, I found sore spots.
A tender spot, I'd say within 10 minutes, by the time the session was over, that spot was not sore anymore.
Yeah, and I noticed when I did the massage first before the cupping, is that I was trying to feel out where I should be focusing on the cups, and it felt like it was your mid-back along the spine. And so that's what I did, and it was mostly on that right side for some reason.
Yes.
And then after I loosened it up a little bit, then I went broader. I basically did the whole back in a fan out motion, one side at a time. And then there are times in which I had to leave the cups on and then started working on your neck or something to that effect. Just to make sure that I'm actually doing something and not just leaving a cup on. And that's another thing that I like dynamic cupping better, is because it feels like I am in two places at once at the same time, saving my hands.
Yes, and I like the upper back, where you would go across the back. That was part of my initial training, so it's like,
Do you know why?
Why?
Okay, good that you brought that up. Is because the spinous processes sticks out on some people, and usually it is not a good idea to go from one side of the spine to the other side of the spine when you're crossing the spinous processes, because it can nick it, and then it hurts when you're actually going across one at a time. And my trick is, because I use these kinds of cups, is I pull up slightly before I go over. Aha.
I didn't notice that.
Yeah, exactly. That. Ooh, secret. Now everybody knows. Darn. But your upper back was actually flat, and also your spinous process on the mid back to the low back were indented. So basically your muscles on the ESGs along the spine were thicker, so that your spinous process were actually on the bottom. So I do not have that problem, except for slightly higher on that upper back, or lower on the upper back and somewhere around the C7 as well.
Right.
So those ones I tend to lift off. This is the reason why I do the massage first, to kind of figure out the terrain and then know what to do with the cups afterwards. So it is contraindicated to go one side with a cup, especially with glass cups. But since we're not doing glass cups, we're using silicone cups. You just pull up slightly if they have a spinous process that sticks out. Most of them are people who are really, really slim, that I notice that they have, you know, the spinous process sticking out, or somebody who actually has that deformity. Another thing that since we only did the back, there are certain things that you do not want to do on other areas, especially sensitive areas. So if you're going to do massage cupping on the arms, see, cupping is really meant for a large flat area. The back is perfect, chest is perfect, glutes are perfect, parts of the legs, the upper part of the leg, the thighs, is perfect. Now if you're going to start cupping the arms, it's not the same unless they're actually having a lot of adhesions or any type of fascia that's really stuck. This area, please avoid. That is very sensitive unless you have a different kind of cups that is not as powerful as the silicone cups. They're smaller and they have the blue bulb. They're for facials. And I do the facial cupping as well, but that's another thing for another time. And no, right now, just to let you know, those facial cups, they're very expensive. So I think mine cost over $50 for 4. And so avoid these areas. These are sensitive areas, and also in the inguinal area, the medial part of the thighs. You avoid those as well. You can also use them on the stomach. It's perfect for stomach massages, and you can do that on your own because you can reach that. When I do self-massage with cups in the back, I usually leave it on there. And the problem with leaving it on there is that you forget it's on there, and by the time you remember, it's a little too late because it hurts. The part of the lip of the cup will start sinking into the skin. And that is my problem, and that's the reason why I prefer dynamic cupping compared to static, which is what most acupuncturists do. So you have been doing some massage cupping. Have you done it at the other place that you work at?
We were taught static,
Oh, what's that?
where you place the cups and you leave them on for within 3 minutes and then move them.
What is it that you use? Do you use the silicone
The
cups?
silicone,
Okay. So the same type that we were using?
same type.
Okay. So I mean, I've done that too. I've left it on, but I try not to leave it on for more than 3 to 5 minutes. It really all depends on the area. So as you notice also on the demo that I did, I would leave it on the middle back, start working on the neck or upper back, and not even a minute later, I move it slightly to a different area, work on another place. The reason for that is because I try to get some blood flow in that area so that later on I can actually start moving it a lot faster without her feeling like I'm pinching or pulling or anything to that effect. And if you've noticed at the end of the demo, her whole back started looking pinkish. Not that kind of pinkish, but pink, fuchsia. So other than that, is there any other feedback from that session? It's only 15-20 minutes on the
But
back.
15-20 minutes on the back was long enough. It was long enough, and even as I sit in recovery mode, you know, I can still feel it.
Good, okay.
So it has a lingering effect.
So here are the different kinds of silicone cups, and also these are the facial cups that I was talking to you about. It's meant for thinner skin like the face, or sometimes it can be used on the inside of the arm if necessary. Like these areas are sensitive all the way up to the past the elbow. But really, I've never used them on people's inside. Yeah, the neck area too. This is perfect. These guys, I've never really used this big one as much other than the cheeks. Yeah, the face TMJ dysfunction, that sort of thing. It's perfect. The problem with this also is it's made out of glass, so you do not want to leave it on their face and then have it fall off and break. And the other thing that I don't like about them is when you're cleaning it up, you have to take the bulb out. And it's a BI, yeah, it's hard to take off. These are the ones that I bought, I do believe, before I bought these. And I really haven't used it. It's just here for just in case I run out of these cups. But these are the ones that I use a lot more. This is what I usually use for low back, glutes, and sometimes the legs. It's big. This is the one that I use a lot more of on the back, the glutes, the legs, shoulder sometimes, the deltoids, and sometimes feet, depending on how big the feet are. Here I use the same thing, the back. Most of my stationary ones are usually this one. Um, and then the small one, it's not as powerful, but I use this also on the hands, the plantar side of the foot or feet. Pretty much a small area that I would like to put it on, like the shoulder, the top of the shoulders. So these are my collection, and there's a lot more since I use more of these. I have only 2 of the big ones. I think I have 10 of these, maybe 12 of these, and about 12 of these. But these bulb one facial cups, I only have this set, and that's all I have. And this one I have 2 of these, 2 of these, and 2 of these, and I've never really used them until these guys run out, and I'll never run out because I have so many. So that's basically what dynamic cupping is with silicone cups. And I'm here with Gwen. I'm Lynn Yancha, and now we're going to get into the Q&A portion. Okay, so now we are in the Q&A portion. Okay, so I know some of you have probably done some massage cupping already. Do you guys use the same cups that I just used? Because that is the most versatile one that I know of. You can pull, push, move it around, and it's easier to grip. Here's a question: how much are the silicone cups? Now, in American dollars, when I bought mine, it can be as cheap as maybe $23 for a set. Yung nakita nyo malaki, paliit ng paliit, apat sila, that's about $20 to $25 a set. You can find some online siguro. I think Dexter found them on Lazada. I think Lazada yata yun. And he bought some, but I'm not quite sure exactly if he bought a set or several of the smaller cups. And then Gimlet, that was Faye's question, by the way. Gimlet, it is my first time to see that kind of cupping technique. So I'd like to have Gimlet kind of tell me what kind of cupping technique do you know? Is it the one that yung iniiwan nila sa body? And then Roxanne said, never use cupping method. What is the best part of the body to use dynamic cupping? Let's see. I have used dynamic cupping on the shoulder, the deltoids. I have actually anywhere. You can put the cup. Okay, here we go. My foot, you can put the cup right here and you can move the toes around. And that's dynamic cupping already. Nakita niyo dun sa ano sa example, nilagay nila yung mga maliliit na cup dito sa ano sa leeg, and then they move the neck a little bit to get some movement from the joint. So you can use it for joint movements, joint manipulation is what we call it. Um, and so anywhere. Cups can be on the face. The problem with that is you don't want to use, hindi mo gusto, hindi dapat gamitin yung ano, yung, shoot, yung ginagamit natin sa face. That is too much and you'll have a red face and you don't want red marks all over the face. The one with the blue bulb is the one that is best for facials. The best, it's always been used on the back. A lot of people use it on the back. But you can also use it on an IT band. The glutes, the upper legs. You just want to avoid the inside of the leg. Alam mo naman, it's really really sensitive dun sa loob ng leeg, ng what is it? The leg. I'm getting confused with Tagalog English. So and also the inside of the arm. Here's the test. Kurutin mo sarili mo. Kung masakit, wag mong lagyan ng ano, ng cup. Pero there's some areas that are so stuck with adhesion that kailangan din ng ano ng cupping but not so hard. Yung kaunti lang ano negative pressure. So and then let's see here. John Paul said check online, shop E. Daisy, I used it once, but it's hard to move at the back of the client. What is the technique to move it? I do it the way of move using glass, but sometimes yung cotton lumalabas pag basa ang nasa oil. For one, hindi ako gumagamit ng cotton. At saka, yung ginagamit ko is silicone. If you're using glass, mahirap talaga. Dahil ang glass, you have to have heat. And the cotton that you put in, you have to put fire in it, and then you put the glass on top of it, and hopefully you have enough, yung seal. You have to have yung oil to seal it, and if you don't have enough seal, you might burn your client. We do not use those kinds of massage cupping technique dito, and I don't exactly prefer that either. Kasi if the cotton is too small and it burns, it will burn the skin of the client. We're not doing glass because you need fire to have suction in glass cups, except for the one with the bulb, the blue thing that with the bulb. But as far as silicone is concerned, you don't need heat and you can use it over and over and over and over again on the same person, of course. And then if you want to use it on a different person, you have to wash it with soap and water really well. If you do not wash it with soap and water really well, then you just basically cross-contaminated everything. It is okay to use 10. Yes. Yeah, on the thumb, the thinner eminence. Yes. Yes, yes, yes. But it depends on how big their hand is. The smallest one, baka hindi pwede sa kamay ko. But you're gonna have to put a lot of oil so it has a good seal. Hindi basta-basta matatanggal. And you can just put it right on your your hand. Here might be a little difficult because of the two bones. When you move it around, it might come off. But definitely you can use it on here. And then you can have the client move their thumb around and do a joint movement. Faye says, thanks for this training. Mas gusto ko ganitong cupping technique kasi mas safe siya kaysa gumamit ng baso na may apoy like we always use. Yes, and unfortunately, yung mga ginagamit na ano na may yung cup mismo, maliliit yung lip. Kaya if you leave it on there, hindi basta-basta yung move dahil it's very, very thin. What is the best brand of silicone to use, or what type of silicone do I use? when I bought the cups, there was no brand. I just bought it from either Amazon or eBay. So just as long as you find one that works, then that's great. Kasi dito sa Amerika, if it doesn't work, if there's something um, is not quite where they say in advertising, then I can send it back for a refund. Eh, dyan naman sa Pilipinas, nakakatakot eh. Walang refund yata eh. If you guys have any more questions, go ahead and post it on the Facebook group if you guys want to do that, and I can answer as many questions as possible there. Okay? Have a good night. Have a good morning, afternoon. Afternoon na pala dyan. So
Yeah, thank
if you guys have questions, just ask me based on what we just learned on the Facebook group. Okay?
Okay, thank you.
Thank you. Bye bye.
Bye-bye.